Good evening, everyone. My name is Stefan Garego, and I will be presenting on the financial management in healthcare. Three different ways of approaching fiscal management in healthcare can all be found on page 4 of Baker, and Dworkin in our book Healthcare Finance Basic Tools for Non Financial Managers. Um, the first viewpoint is financial, second is processing, and third is clinical. A financial view is done by those managers who work with finances on a daily basis. These types of managers deal with reporting as a main responsibility and are usually performing strategic planning for the organization. In my eyes, these managers include more upper management, um, like the chief financial officer or the chief operations officer. You could probably include the director for accounting or anything along those lines. The process view of fiscal management works with the system of an organization and are primarily responsible for data accumulation and are usually a part of the information system portion of an organization. In my eyes, this is like the IT director or the director of quality. Um, these types of managers can be viewed as, like I said, middle management or directorship level management. The clinical view is the third approach to fiscal management in healthcare. These are usually supervisory level positions, doctors, clinical personnel, and/or lower level management. Uh, they are more service oriented and work directly with patients and clients and are responsible for the clinical outcomes within a healthcare organization. So these types of people are the face of the company. And if they cannot or do not present a good face for the company, it is very hard for fiscal management and financial management to, as a whole, be productive. Um, all three different approaches play an intricate role in the financial success of an organization and must be able to communicate and interact with one another for their departments and organization to be successful. Um, at my last position, I was the director of quality compliance, and I have played a role as a manager who takes a more processing view perspective. Part of my duties as the director of quality compliance was to look at process improvement methods to better improve productivity within each department of the laboratory, from accessioning to billing to bench work to administrative responsibilities and even deciding out of cases by the pathologists. Um, to do this, I would incorporate the DMAIC or the DMAC methodology from Lean Six Sigma. DMAC is best defined by Satyadi 2013 as a data driven improvement cycle managed through 5 steps: define, measure, analyze, improve, and control. DMAC is useful for large and complex programs or problems to solve. Um, this is why I would use it on a departmental level. By utilizing this process, I was able to collect and analyze data and present it to the leadership committee on ways to cut costs and work more efficiently. It ultimately ended up saving the company tens of thousands of dollars annually. The benefits of each of the fiscal management approach is that there are managers that know their positions inside and out. Um, but this is also can be a drawback as they do not sometimes understand big picture or even microscopic viewpoints like a clinical view would um, from the way a financial viewpoint would be. The financial manager will be able to understand big picture, whereas clinical manager better understands the micro perspectives. By having all three views communicated amongst one another through uh, monthly or quarterly meetings, they're able to better set financial goals and allocate funds accordingly by department or within the company for their annual budgets. I'd like to end with a biblical quote from Genesis 2:15. The Lord God took the man and put him in the Garden of Eden to work it and keep it. Financial managers are stewards of the healthcare organization they work for. They are placed in their positions to help grow the company and ensure it maintains its success from a financial standpoint. They must ensure that they keep the company's best interests in their minds whenever they are making financial decisions. Um, we as Christians must keep the Lord's word and act upon it accordingly, especially when it comes to being stewards of not only the company we work for, but of the Lord. Um, Thank you, and I look forward to reading some of your responses. Have a good night.